like this, the top, or the small one, because for the neck would be okay. So the points are stationary cups to point. This groove just behind the occipital, behind the sternocleidomastoid, at the suboccipital line. So just behind the groove behind the sternocleido SCC attachment. This is the first point. The point is in your handout. And they are really good to use from patient to patient. I have my personal set that's for 3 years so far. But you have to clean so good before and after, and to even washing soap with water too strong here because he's wet bearing and the muscle is high. This is my first point. Then my second point is, may I use the other option? So also I will use alcohol or sterilizer, whatever is affordable. Points like irregular points, those are better. The point is from here, from the top of the shoulder or from the nipple, I go up. So from the nipple, I go up to the top of the shoulder or midway between the shoulders, starting from the pinch mark of that AC. Okay, so from the AC we can go to the middle or from the nipple at the top of the shoulder. So I will put it here. And here I will do 1 and 2 as like a medium one. 1 pump, 2 pump. Third one is suggested to be on C7 above the spine, not on the spine itself. So I can use a small one or big one. How to get C7? Patient bend forward, prominent one. Good. So again, clean, make sure the ends. So from here, flexion, and I will do the C7, it's above. And by the way, this is a common point between the dry and the wet cupping. Whoever practiced the wet cupping, you know that the C7 and the sternum, this is the sonna points. This is the prophetic sonna points. So we put it in almost every cupping application from the traditional point of view. We also found it in the musculoskeletal conditions for cervical spine. So we will do so, and then those are the stationary points. May we also add, that's okay so far. May you make it this a little bit up, this is too tight. May we make it a little bit up. In other references, we have, okay. So if it's irregular like this, I make notifications. And may I add like supraspinatus like with this, for example, if I wish. Okay? Option. Supraspinatus above the spine of the scalp. But for me, because I'm gonna add movement, so I will take the base. On the groove, top shoulder and C7. This is first option. Second option is massaging, dynamic cupping or massaging. Okay? May I leave one of them and massage with the other? Where I gonna massage? From the stationary point to another. This is an option. This way. And here I have to follow the line. If I go like this and I continue, so it will be up. But I have to follow the line. Okay? This is massaging. Or I can, you remember the superficial line, that one with the erector spinae? I can take it from here. You remember? Or I can do massaging with patient moving. Can you take your head away, please? Go away like side by side to the other side. From the other ear to the other side. And I do this. Come to me. Okay, and I do this. So go. And I can do this. Moving cups, moving patient. Moving cups, moving patient, and I can pass by the overactive sternocleidomastoid that we are, I can do the first point, and then I can start to spread in the front to the anterior. Yeah, yeah. And dynamic will help in being safe because vessels are so much here. Okay? How it feels? Relax. Yeah? So this is static, dynamic, moving with moving. So what else? What are the last options? Stationary with patient movement. So I will link this back to the first one. What movement you want this patient to do and for what purpose? Now I am done. The patient will carry on the job. What movement? Normal range of motion, and this is what the study of the neck gives. Right for range of motion, flexion, side bending, 10 times, and rotation, we have an outcome, and you have the study in your handout. So can you do flexion, please? How it feels? Is it okay with the cup? This might happen. So we modify a little bit. We give room for the patient is straight. And my advice, if you will do moving cup with cups, don't make the cup too strong. So to give room for the tissue, you know? Now it's good? Easy? Good. So this is an option. What else? Stationary cups with moving signals. We will reach now. Stationary cups with moving. What do you think? Can you do some hemodynamics? Yes, that's it. If you are speaking about cervical spine, we have a strong neurological conditions, aren't we? So we can use the cups easing off the muscles and go for the neurological conditions. And this can go for the shoulder, for the forearm, for the carpal tunnel syndrome, for whatever the symptoms. Can refer any pain in the upper limb would be referred from the cervical spine. Neck pain, tension-like pain, pain referred to the middle of the back, can be referred to pain, neurogenic nature from the cervical spine. So here is that chance to start to have the myogenic pain and also go to the more sensitive structure and do neuroflossing. Can you do neurodynamic